Hi everyone, I'm Karen.
And I'm Joe. Together we're part of the amazing team here at marketplaceamerica.org.
Now, health insurance may seem complicated, but it's a crucial safeguard against unexpected medical costs, and we're here to help make it simple.
Yes, indeed. We're here to guide you, educate you, and help you navigate the world of health insurance with ease. We want you to make the best choices for you and your family's health.
Yes, our commitment is to make health insurance understandable, approachable, and tailored to suit your individual needs.
So join us as we dive into the ins and outs of health insurance, and remember, we're always here to help you.
Be sure to like. We're here to discuss an important healthcare issue, Medicaid eligibility checks in 2023 and potential loss of coverage for millions of families.
That's right, Karen. Losing Medicaid. There's going to be over 15 million people that are going to actually lose Medicaid. And to put it in more in perspective, approximately 84 million people are currently covered by Medicaid, but states are gearing up to check eligibility for the first time in 3 years. This could result in up to 15 million people losing their access to Medicaid.
That's right, Joe. The reinstatement of eligibility checks follows the cessation of pandemic policies that prevented states from removing people from Medicaid.
Absolutely. Those pandemic policies, they froze people, and it didn't matter how much they made.
Yeah.
Okay? So people might lose their Medicaid coverage if they start earning above the threshold, acquire health coverage through their employer, or move to a different state.
Also, those failing to submit the eligibility forms are going to risk losing coverage.
Absolutely. It's important to note how people will be informed about these changes, Karen. They will be receiving a renewal form by mail and a second notification through the phone, text message, or email. They're going to have a 30-day window to fill out and submit the form.
That's right, Joe. And a newer approach like mass text messages is being adopted to ensure recipients are adequately informed.
Absolutely. And I just think about everybody that's moved, they've changed status, or and hopefully the records are updated. But it's
Right.
going to be a massive problem getting this information out to a lot of these people.
Now, a crucial aspect of this change concerns children's coverage. Over half of U.S. children receive health care coverage through Medicaid or the Children's Health Insurance Program, or CHIP.
Wow, over 50%. I didn't realize that was high. That's a crucial point, Karen. Even if parents lose eligibility, between 80 to 90% of the children will likely remain eligible for Medicaid or CHIP. Parents need to understand that their loss of eligibility does not automatically mean their children will actually lose coverage as well.
That's right. Now let's discuss solutions. Many people who no longer qualify for Medicaid can turn to the Affordable Care Act's marketplace for coverage, and that might cost less than $10 a month. However, it may come with higher out-of-pocket expenses and copays. But there's a special enrollment period from March the 31st, 2023 till July 31st, 2024 for those unenrolled from Medicaid.
Karen, that's great. And I like to say from $0 per month.
That's right.
Okay? Because we see a lot of $0 plans out there. That's a crucial lifeline that they actually threw them with that new special enrollment period, Karen.
Yeah.
Furthermore, financial assistance can also be utilized from the marketplace, such as a premium tax credits. Okay? And people that are actually signed up for Medicaid must fill out an application to find out if they qualify for these savings.
That's exactly, Joe. It's important to apply for marketplace health insurance, verify your income, and keep your documentation up to date to secure affordable health coverage after Medicaid.
Absolutely.
Welcome to marketplaceamerica.org, Health Insurance Simplified.
As your trusted partner for health insurance, we're proud to be fully integrated with healthcare.gov, offering the same plans at the same prices.
What sets us apart is our streamlined process, which gives you access to 1-minute quotes and 10-minute enrollments.
With us, you gain the advantage of personalized assistance from licensed agents at no additional cost. Our primary aim is to provide you with hassle-free experiences, all while respecting your privacy.
And rest assured, we don't ask for any identifiable information until it's time for you to enroll in a plan.
Ready to explore your options? Start by clicking on the See Plans and Prices buttons on marketplaceamerica.org.
You might be surprised to find plans starting from $0 per month.
Welcome to marketplaceamerica.org, where navigating health insurance becomes an effortless task.
Let's take a look at some plans on the website.
Absolutely, Karen. I know they're upset. They're losing Medicaid. It's been great for them for 3 years.
Yes.
But let's show you how to actually get covered and how easy it is to get coverage and to qualify for that financial assistance. So we're here at marketplaceamerica.org. Get affordable health insurance, family health insurance online. It's as easy as coming here and clicking this button right here, see plans and prices. Now, Karen, we kind of like to use the zip code 29303. That's one of our local zip codes, and we know how it works. And we're just going to hit continue. And now it says, who needs health coverage? Well, in our example here, we got a family of 3. We got a mother, and she has a 7-year-old son and a 5-year-old daughter. Okay? So how old's the mom?
Oh, we'll say 35.
All right, so let's say she's 35 years old, and we're going to say she's female. She doesn't smoke tobacco. She's not pregnant. And she's not eligible for coverage through a job, Medicaid, CHIP, or Medicare. She's actually losing that. She doesn't have a spouse. We're not going to add a spouse, but we are going to add a dependent. How old is our first dependent?
Oh, we said 7.
And that's a male.
Male.
And he's not a tobacco user, and he's not actually eligible. We're going to leave it unchecked at this point in time. And then we're going to add another dependent.
And we're going to say this is a 5-year-old girl.
Okay, and we're going to say female here. And we're going to say not a tobacco user, not eligible. And what we really want to show you is we're going to get right here, one more screen before you can see what we want to show you. And we have a household size of 3 right here. And already knew that. And we're going to estimate our income to be how much?
37,000.
Okay, so we're going to say estimated, and that's an estimate. Okay,
Yes.
you got to understand that's an estimate. So you estimate your income and you put the estimate. It doesn't have to be actual. It's purely an estimate. So we're going to hit here and hit continue. And wow, Karen, what do we've already got right here?
Well, she qualifies for 2 kinds of savings. She could be $551 a month towards her premiums.
Those are premium subsidies, and it shows that you can actually qualify for plans from $0 per month, which is huge.
Yes.
What else does she qualify for?
She qualifies for cost sharing reduction. That gives you cheaper doctor visits, hospital plans, cheaper prescriptions, lower deductibles, and a lower out-of-pocket max. But you need to choose a silver plan for this to qualify.
Absolutely. And we could hit continue, but before we want to do that, I want to slide on down here and you see what this is. It says these applicants may be eligible for South Carolina Healthy Connections and CHIP. Well, that's her 2 dependents. So although she's losing Medicaid, Karen,
Right.
it looks like her children are still eligible to stay on Medicaid.
Exactly.
Which you need to understand how that works. Just because you're losing Medicaid doesn't mean your children are going to lose it. And you need to understand that.
And if they sign up for a plan on this site, they'll automatically send the children's eligibility to the state plans.
Okay. All right. So here we want to go ahead and hit continue. And we're going to say the reason we're signing up is we're lost or losing coverage. And if we look right down here at this note, notice it says lost Medicaid or CHIP coverage between these dates. Okay, so that's why she's actually eligible to sign up during the special enrollment period,
Right.
which is what one of the things we are right now. So we're going to go ahead and check that box and hit continue. Now, if you're getting ready to actually sign up for a plan, you want to make sure that your network or your hospital system and your doctors are covered. This takes a little bit more time, but in the interest of time, we're going to actually skip this step. But if you want to check that, you just type that in. You can check that. You can also do the same thing with your prescription drugs. But we're going to actually skip this in the interest of time, as we want to actually take you to where you can actually see the plans that you might qualify for. And Karen, what do we got here?
0 premium and 0 deductible. I noticed that on the first plan.
Off the bat, a double zero plan. Here's our out-of-pocket max. We got co-pays. You can click here and see plan details. Look at the next plan, Karen. Another $0 premium, minor deductible.
Yes, small deductible, but look at that out-of-pocket max, $2,900, and that's our silver plan. You notice the silver and the CSR star.
Cost sharing reductions, absolutely. So this is, in my mind, a better plan than the one above, because you've got a lower out-of-pocket max. You're still on 0 premium, and you've got cost sharing reductions here. But you can go ahead and go through these. The other thing you can do once you're here, you can actually sort these by the metal levels. You can sort them by the carriers.
Yes.
But you can do a lot of stuff here. But if you get lost or you need help Pick up the phone, reach out, call us. We'll help walk you through this whole process. It's that easy.
Yes. And we'll have another video on your step-by-step enrollment.
Absolutely. If you want to see our other video on step by step, we walk you step by step all the way through the application process and everything, so that you can actually self-enroll on our platform.
Okay.
So Karen, in conclusion, we want to actually emphasize the importance of understanding this potential problem and the necessity of staying informed about how the Medicaid eligibility process actually works.
Absolutely, Joe. And remember, solutions like the Affordable Care Act's marketplace and financial assistance are available. So let's navigate these changes together and secure our health coverage. Thank you for joining us today.
Absolutely. If you don't have health coverage, get coverage today.
Well, that's a wrap for today. I hope you found our discussion to be enlightening and valuable.
Yes, thank you for spending time with us today. We strive to make health insurance easier to understand and navigate, and we hope we've done just that for you.
If you have any questions, or if there's a topic that you'd like for us to cover in the future, please leave it in the comments down below. We're here to help.
And don't forget to like this video, subscribe to our channel, and hit that notification bell so you won't miss out on our future videos.
Remember, at Marketplace America, we're not just providing health insurance, we're providing peace of mind.
And if you are breathing and not covered by health insurance, stop procrastinating. Sign up for a health plan today.
Until next time, stay healthy and informed.